Hello, and welcome to Riverside Reflections. I am your host today, Denise Mananas. I'm the Associate Vice President of External Affairs for St. John's Riverside Hospital. And today our guest is Sherlon Quarless, who is the Assistant Vice President for Outpatient Services for our Behavioral Health Services Department. So welcome today, Sherlon. It's nice to have you.
Thank you. Nice to be here.
So today we want to talk a little bit about your role. You've had quite a path to becoming a real leader in the Department of Behavioral Health Services. Let's start by talking about the path that you've been on at St. John's, when you started, and how you've arrived to the position you're in now.
Okay, so in 1997, I started as a nurse's aide on the detox unit at St. John's.
Wow.
And I worked with St. John's for about 7 years. After those 7 years, I went back to school. After seeing that nursing was not what I really wanted, I wanted to work more with the clients to help in a different way.
Okay.
So I went back to school, got a degree in social work, and came back to St. John's in 2017 in a different role as a social worker.
Okay. And you came back a little bit better credentialed. Can you just tell me
A little about that?
Just
Yes.
tell me what you did.
So I went back to school, became a licensed social worker, and then I went back and got another master's.
So two masters.
Two masters.
Because one is not enough.
One, it's not enough.
Of course.
You need something to balance out the other.
Okay.
So I got a second master's in public administration because I figured I knew the clinical side, but I also wanted to know the administrative side.
Okay.
So
Very interesting.
Yes.
So that sort of primed you for the next role that you got, which was?
Yeah. So I came back in 2017 as a clinical supervisor
Okay.
in our patient welcome center.
And then that became?
And that became, after that, then it was assistant director, and now ABP.
It's beautiful.
Yes.
Congratulations on that.
Thank you.
That's a great responsibility that you have.
Yes.
Gotta love St. John's.
Gotta love St. John's.
Such great opportunity.
Yes.
Okay, so last season in Riverside Reflections, we did a program with one of your colleagues, Kim O'Mara, and she spoke about many of the different services, but I do want to just reiterate our outpatient services because they now all report to you.
Yes.
Okay, so just give me the list.
So we have in Greenberg, we have the Greenberg Addiction Center.
Right.
Then in Mount Vernon, we have the Archway Center.
Okay.
And here in Yonkers, we have CRC.
So CRC is Comprehensive Recovery Center.
Yes, Comprehensive Recovery Center. Now, CRC is the integration of the old New Focus, where I was the director, and our methadone program.
Okay, that's very interesting. And I do want to come back to that discussion about the CRC. But before we do that, I sort of want you to give me what sets our outpatient rehabilitation services apart from other places in the community that offer similar types of services.
I would have to first start with the staff.
Okay.
We have an amazing, 100% of our staff, they're all credentialed, they're all licensed, and they all come with that drive and that passion for our patients. Very client-centered. Very client-centered. They're passionate, they meet the patients where they're at, and I think that's the number one thing. Because you can have a program and you don't have the staff that,
right.
So I think I have to start with the staff. The staff's amazing. And we have MATS, which is Medicated Assisted Treatment. And this is where we have Suboxone, we have Methadone, we have Vivitrol. And this sets us apart because not every program have that. We give every single MAT that there is.
All right. So in the Comprehensive Recovery Center, you give Methadone.
We give everything.
You give everything. All right. But now what about in the Archway and Greenberg?
The others don't get the Methadone.
Okay. So they get Suboxone.
End of it, yes.
Because why is that
because if they're in our programs, they get our Methadone. We only have one Methadone program because of the DEA. So there's only one Methadone program.
Okay.
That's very federally regulated. So that's one. The others can be prescribed.
Okay.
You get from the pharmacy.
Right.
But Methadone is very different.
Okay. And also at the sites, is it true that there's a dosage difference too? Like Methadone, you have to come every day, but Suboxone, no? How does that work?
The difference is Methadone, you have to come to the clinic every day.
Yeah.
You have to come into the clinic. Suboxone, you can go to your doctor and get a prescription and get a 30-day supply and be home.
Okay.
And the Vivitrol is a once-a-month shot, so you don't have to come every day.
All right.
So that's the big difference. The big difference is that they call it liquid handcuffs because you have to go every day to the program.
Oh.
Yeah.
So that's very interesting.
Yeah, because not every, think about the homeless people and just people that just can't
Get
maintain.
somewhere.
Yeah, you know, you have to be doing really well on methadone for the doctor to actually give you Suboxone because you have to maintain it. If I don't have my own apartment, where am I putting this methadone? Where am I putting this medication?
Right.
So
I get it.
Yeah, so that's, you know.
Okay, that's
a big part
very
of it.
interesting.
Yeah.
All right. You also in the outpatient sphere offer different tracks to meet, as you put it, to meet the clients where they're at, to meet the patients where they're at.
Yes.
So let's talk a little bit about some of those. You've got adolescent, Spanish group. Go through some of that for us.
So at all of our sites, we do individual sessions. We have group sessions. We have bilingual services because that's very important, right?
Yeah.
Especially at our Greenberg location because there's a very heavy Spanish population in Greenberg.
Okay.
So we have bilingual service. So we do group and individual sessions in English and Spanish. We have a large, I want to say about 85% of our patients have had some dual diagnosed mental health.
Right.
It could be slight depression or so we do have a psychiatric nurse practitioner where we are able to address dual diagnosis.
Very nice. That's fairly new.
That's fairly new
Yeah.
and much needed.
Yeah.
So we have that at all our sites.
Great.
We also service adolescents, and that's very important because we are finding now that prevention is the key, right? So we don't want those adolescents to be the patients that we have now. So we partner with the schools in Yonkers to actually now have sessions with the parents to talk to them about what to look for
and how to prevent
and
the
how
kids
to
from
prevent
getting
it.
into this.
Yes. How do I
Very
know my child
fabulous.
is using? Yes.
That's great. There's a different audience too that we're looking at, and we're starting to make some headway in, and that's professional people who are being either mandated to get treatment, depending on the company they work for, but they can't go in for inpatient care and they need to maintain their employment. So you're doing telehealth visits as well.
That's the biggest thing now because ever since COVID, many of the programs and many doctors' offices, I have my doctor's appointment by telehealth.
Wow.
So that's now the way to go. So what we do is if you can't come in, if you have work, if you're a mom that have childcare issues or you have a medical problem that you can't get out to treatment, we can actually do telehealth services with you, and we do. So at all sites, we do telehealth services.
That's a beautiful thing.
Yes.
Yeah, very, very much needed. And I think it helps people maintain their privacy also.
Now, that's
they're not
thing.
going into a place.
Yeah.
That's very interesting. I wanted to go back to the CRC, the Comprehensive Recovery Center. As you mentioned, it was our new focus center, and then it was our methadone or what was it? The opioid treatment center. So we integrated. So what was the point of putting those two services together, and what's going on there now?
So the big point and the big push was that in the OTP program, for a long time, patients just came in, got dosed, and went home.
Right.
In the new focus center, we had individual sessions, we had groups, we had recreation. It was more of a therapeutic environment versus just getting your medication and dosing.
Right.
So by putting the two together, now we have those patients that really need the therapy and need the individual sessions. Now they come and they get dosed, they can catch a group.
Right.
They can see the nurse for a nutritional assessment, or they can see the psych for a mental health.
That makes
so
sense.
that was it was a one-stop shop, and that was the whole push behind the integration.
Okay. That's very interesting.
Yeah.
This is such an interesting career choice, as an outsider to this career.
Oh yeah.
Looking at the people, I do actually have a one finger of my career in managing our outreach team for behavioral health. And I watch everyone who works in this field, and it is really a labor of love. So when you choose to do this, or you gravitate to it, there's got to be something in your family, in your way you were raised, in your experiences that maybe guided some of your decision making. Can you share any of that with us?
I'll share a little bit about growing up in the islands, right? And everyone drank. Culturally, that's what they do. I go back on vacation, everybody's drinking. It's the thing that we do.
Where are you from?
Barbados.
Okay.
But in that, my mother was an alcoholic. But I didn't know that until I got here.
Right.
And realized that drinking wasn't normal. It wasn't what people do. Because back there, everybody did it.
Right.
I would see the changes, and I had the life with my mom and the things that happened, but never really understood until I got here. And then there was no treatment. There's no treatment because it's what everybody does.
Right.
So coming here then and really understanding and seeing that addiction is really a thing, and that my mom really had a problem. So like I said, when I was a nurse's aide and I'm listening to the stories and I'm seeing the behaviors and I'm like, wow.
I relate to this.
So that's where it clicked for me. Like,
interesting.
Oh, my mom was an alcoholic.
So when you started down this path, was your mom still with you?
She was, and alcohol actually killed her.
I'm sorry.
Yeah, so it's about 2 years now. This June will be 2 years that she's gone. But
she saw you in this field.
She did. She saw me all the way up until senior director at New Focus.
And what was her reaction to it?
She would always joke, because when my mom worked at St. John's as well.
Oh my.
So when she called me to get the job at St. John's as a nurse's aide, I said, I'm not working with those people. And back then, to me, it was those people. I had no interest, didn't really understand that,
it's everybody.
It's everybody. Didn't understand it. So she would always joke. She was like, oh, look at you now. Those are your people. So that was the thing with her. You never wanted to get into that, but here you are.
So she never saw herself as those people.
She understood later because we had those conversations.
Yeah.
As she started to get ill with her kidneys and the diabetes and understanding that alcohol was I had those conversations with her later before she passed.
Wow.
Like, this is what happens. Sharing stories like, Mom, this is what happened because the alcohol was the issue. But then helping her to see that, you were drinking for a reason. Because as I started this journey, I realized that people don't just drink or they don't just use drugs. There's always an underlying issue.
Right.
So then going through that with her and helping her to see, well, Mom, this is why people do this. So
yeah. Thanks for sharing that.
Yeah.
I know that's really personal.
Yeah.
So, I know that this is, as we've talked about, this is a tough job, and getting to a point where you see success in your patients and in your clients, it's not as frequent as we would like. There's a lot of recidivism. There's a lot of slipping back. Can you tell us one or two patient success stories that you have and make it real?
Well, first we have to understand that relapse is a part of the process.
Yeah.
So when
fascinating.
It is truly, and if you understand that, you will see your successes more than you don't see it as a success, right?
Right.
So I've had so many successes.
Oh my God. So Sherlon, that is such a profound statement, because I don't know that anybody thinks about relapse as being part of the process.
And it is.
That's amazing.
It is. It's a part of the process. And you'll have many relapses, but you'll always, and I always say, you can recover. Relapse will be a part of your story, but you can come out on the other side.
So you have one that you can share?
I'll share something recently. So we had a patient, this is out of the Mount Vernon clinic, and he was an auxiliary cop who went out drinking and got into an accident and hurt a police officer.
Oh.
And of course, this changed his life. It was, back and forth to court. Now you have a DWI, you could lose your job. And I want to just say how profound it was, because the counselor that worked with him advocated where he didn't have to go do jail time. He went on the weekend, did jail on the weekends, Friday to Sundays, came back. And at the end of all of this, he was able to get his license back, get his job back. So we have a lot of those stories. If the patient is serious and take the path It happens. I've
Wow.
had quite a few success stories.
I know we actually have, and there's another one that we can actually bring up, and he's actually consented to being a guest in another.
Yes.
I'm not going to mention his name,
So
but tell me a little
I'll
of
tell
the
you a little
story.
about him.
Yeah,
So
yeah.
he's out of our Yonkers, the New Focus Clinic, and he was a
And
young.
he's from Yonkers.
And he's from Yonkers.
Yeah,
Yes.
yeah.
The young man who actually was being charged with murder came into the clinic and worked with our staff. Worked through it. He had gone from using marijuana all the way up to the hard stuff. He went from movie star to
And he is. Yeah.
yes, to being, jail.
In jail.
Jail. That was his bottom. And he worked with our staff, and he worked and he worked, and he was able to overcome that and come up. Now he's acting again.
Yeah.
So we've had quite a few.
So that's an amazing story. Do you have another story that you can share with us?
There's so many stories, but one that stands out is there was a mother in Yonkers, and it was a big story where she had put her kid in the tub, and the baby drowned.
Oh no.
And she was sent to us at New Focus as a part of her legal obligations. And we worked with her and worked with her and worked with her. And that in itself, she actually ended up going to be a big speaker at like my sister's place and did a lot of work then for women who had done the similar things that she had done.
Right.
So it started though where, and it's always where drugs is involved, right? She was high and
Wow.
lost her kid and was just sent to us, and we worked with her, and that was another success story.
Well, those are some tough stories.
And they're tough.
Yeah.
And they're tough. You walk in and you say to yourself, well, she killed her kid. And for the clinicians who have to work with that as well,
It's
like,
hard.
constant supervision. Like, did you know she said this? And, having that conversation with the clinician, because that's a lot of hard stuff to deal with.
Yeah.
But we do it.
And try to get out of your own way and get out of your own judgment about
Yes.
things like that.
Yes.
That's a great
Yes.
testament to your staff. They have to work very hard to
Very
to
hard.
do the right things.
A lot of supervision.
And they do the right things.
And they do.
Yeah.
And they do.
Yeah.
Yes.
Thanks for sharing that.
Thank you.
That's beautiful.
Yeah.
It's such a testament to the staff
Yes.
on how they deal with people who are in crisis. And I think a lot of people in our communities, because we serve a very vast and wide community of so many different types of people, but substance use really does touch everybody.
Everyone. And I say that all the
Everybody.
time. It doesn't discriminate.
No.
And and that's the beauty too of our programs. We have doctors who can, lawyers. It does telehealth. If you don't want to come in
Right.
and be a part of a regular setting, but you have a problem, pick up the
Yeah.
phone.
Yeah.
The help is there
Yeah.
because it does not discriminate. We have every walks of life, every nationality, every color. Addiction is real.
Addiction is real.
It's real.
Yeah.
Yes.
Sherlon, you are amazing.
Mhm.
Thank you for being with us today.
Thank you, Denise.
I really appreciate your time. And thank you to our audience also for being with us today. We'll see you again soon.
Thank you, Denise. Okay.